What's going on, everybody? My name is Chris Chase, and I'm going to be going over some hinging, coaching cues, technique points, troubleshooting, things like that for you guys today. So I am describing a movement that necessitates more hip flexion than anything else. So in other words, this is showing hip flexion. This is showing more knee flexion and ankle flexion, which would then be considered more of a squatting movement. So to be clear, what we're going into is that world of deadlifting or Romanian deadlifts or single leg RDLs. Now, in a hip hinge, what are we trying to target? Mostly we're trying to target muscles on the back of the leg, or as we would call posterior chain, okay? What muscles are those? Well, mainly glutes, hamstrings, these primary drivers of these athletic sort of movements if you're catering to an athletic population. So in your head, you're saying that it would be beneficial to target those muscles using this hip hinge sort of exercise. And that is true. It may be beneficial for this athlete. And how do we determine that? Well, we determine that based on the skill that this athlete or this person displays when performing a hip hinge. They may be good or they may be really bad. If they are bad, there are probably more negative consequences to that exercise. And what are those negative consequences? Well, you've probably seen in the past a common issue with things like deadlift is low back soreness that you may experience because in a deadlift movement, for those experienced trainers out there, if you've done this before with athletes, a lot of athletes will end up driving the movement with hyperextension of your back, okay, to put it kind of in broad strokes terms. Basically, you're using back extension to perform a deadlift. We don't want to do that. We want to use muscles of your legs to drive this exercise, to drive this deadlift or this hip hinge challenge that you're subjecting the athlete to. So what are the positives? The positives are that you may get muscles of the hip or the lower limbs stronger. Muscles, like I mentioned before, glutes, hamstrings. And you believe that whatever hip hinge whatever variation of a hip hinge that you use is going to lead to that. So what does that tell you? We have to pick the right variation of the hip hinge that the athlete has the joint prerequisites for, that the athlete is skilled at doing and they can do the right way, or the way that you determine is most beneficial for the athlete. So in other words, I'm choosing a one-leg RDL because I know the athlete can perform that exercise with the correct strategy, the strategy that allows the athlete to target the right muscles and the right pattern that we are trying to get out of that exercise, okay? So that's an important piece to think about as we move along. It's not necessarily trying to train the deadlift that everybody has to do a deadlift. That's just not true. Athletes don't have to deadlift, but if you can find a hip hinge or deadlift or RDL exercise variation that the athlete can do and they can do well, then let's use that. So how do we figure that out? Well, we need to understand the principles of a hinge. If I were to demonstrate a proper hinge, it would look like this. Okay? Now what am I trying to do? I'm trying to flex and posteriorly translate my hips. In other words, my hips are moving backwards. Flex and translate my hips backwards to load my hips. In order to control the downward movement of this hip hinge or deadlift exercise, I would like to use my hip musculature or hamstrings to control. And if I don't, I will probably use back. If I just fall forward without loading my hips, then most likely my back or the muscles of my back will probably be the muscles that drive the control of that movement. And we don't want that. Maybe there's other people who would want that and target that for a different purpose, but most of the time with athletes that need to play a sport, I'm going to use this hip hinge as a way to target lower limb musculature.